Lower cross syndrome. Causes and treatment. Lower cross syndrome occurs when there is an imbalance in the strength of the muscles around the pelvis. The condition can affect a person's posture and movement, as well as causing pain or discomfort. Treatment can involve strength training and stretching. In this video, we look at lower cross syndrome in more detail, including what it is, the common causes and symptoms, and the treatment options. What is it? Lower cross syndrome gets its name from the cross pattern of affected muscle groups. According to the National Academy of Sports Medicine, lower cross syndrome is one of the most common compensatory patterns in the body. In other words, the body adds a new movement in an attempt to make up for a lack of movement or strength in one area of the body. In this case, weakened muscles include the abdominal muscles and the gluteus maximus, which is the largest muscle in the buttocks. People with lower cross syndrome typically also have tightened hip flexors and lumbar erector spinae, the group of muscles running from the base of the skull to the hip. In many people with lower cross syndrome, the tightened muscles pull the pelvis out of its normal alignment. The abdominals and gluteus maximus typically offer a counter pull and keep the pelvis in line. However, weakness in these muscles allows the additional pull from the hip flexors and lumbar erector spinae to change the person's posture and movement patterns. To compensate for these issues, the person's lower back arches and their pelvis tilts forward. Other people may notice different changes in their posture depending on the affected muscles. Causes. The most common cause of lower cross syndrome is a sedentary lifestyle. Sitting for prolonged periods can cause an imbalance between the muscles to develop. Another potential cause is overtraining certain parts of the body while undertraining others. For instance, if a person strengthens their hip flexors and back without focusing on their glutes and abdominals, this could lead to an imbalance. Several muscle groups can potentially cause lower cross syndrome when they become weakened or tight. Muscles that can become weakened include the gluteus medius, which is on the outer surface of a person's pelvis, transversus abdominis, which is on either side of the abdominal wall, gluteus maximus, which is in the buttocks, posterior tibialis, which is in the lower leg, internal oblique, which is on either side of the abdominal wall, anterior tibialis, which is on the outside of the tibia bone. Muscle groups that can become tight and contribute to lower cross syndrome include the erector spinae, which is a group of muscles that run the length of the spine, latissimus dorsi, which are a pair of muscles covering the lower back, adductor complex, which is around the thigh, hip flexor complex, which comprises hip muscles, soleus, which is a broad muscle in the lower calf, gastrocnemius, which is the chief muscle in the calf. Symptoms. Lower cross syndrome can affect both posture and movement. A person may not be able to stretch fully or correctly. Doing so may also cause aches and pains in the body. According to the American College of osteopathic family physicians. Lower cross syndrome can cause two types of posture, type A and type B. Both postures feature hyperkyphosis, which is the curvature of the spine that causes the top of a person's back to appear more rounded. Hyperlordosis. This is a condition where there is excessive curvature of the lower back. Type A posture. Type A posture occurs due to the pelvis tilting backward. It causes the buttocks to lift and protrude outward while the pelvic region tucks under the body. The lower back also arches inward. Features of the type A posture include thoracic hyperkyphosis. Hyperkyphosis is the exaggerated rounding of a person's upper back. In this case, it has occurred on the thoracic region of the spine. Lumbar hyperlordosis. Hyperlordosis is the curvature of the spine. In the type A posture, it is affecting the lower back. This causes the lower spine to arch inward. Anterior pelvic tilt. This means the pelvis tilts backward. Slight hip and knee flexion. In the type A posture, the hips and knees are bent. Type B posture. Type B posture occurs due to an arch in the upper back near the shoulders. The arch forms a bulge in the upper back and forces the neck to tilt forward and appear outstretched. Features of the type B posture include head protraction. The head protraction is a result of the misalignment of the spine. Thoracic hyperkyphosis. Similarly to type A posture, the upper back is rounded. Lumbar hyperlordosis. The lower spine arches inward in the same way as it does in type A posture. Knee recurvatum. This means that the knees bend backward. Treatment. If the pain is severe, a doctor may recommend taking over-the-counter pain relievers. They may also suggest applying heat or cold packs to the affected area. A person should avoid taking medications for extended periods and talk to a doctor before taking drugs to treat lower back pain, particularly if they are taking other medications. The goal of treatment is to correct the person's posture through retraining the muscle groups responsible for the imbalance. Once a person corrects the imbalance, their posture and movement should return to normal. A person can talk to a physical therapist, certified personal trainer, or another healthcare provider about an exact exercise program to follow to help treat lower cross syndrome. A therapist or trainer can create an effective program for the person. They can also demonstrate proper form and provide general guidance throughout the process. When to see a doctor. A person should talk to a doctor if they have persistent lower back pain. It could be the result of lower cross syndrome or one of several other underlying conditions that can potentially cause pain in the lower back. It is also a good idea to talk to a doctor before starting any new exercise program, particularly one that aims to help correct a person's posture.